Hello, everybody.
Hello and welcome to episode 4 of the Diabetes QI Collaborative podcast. We're joined today by Joe Kitchen and Amanda Grayson, patient advocates at the Calderdale and Huddersfield Trust. Joe and Amanda's team were in the Sheffield Wave 10 of the QI Collaborative, starting the programme back in October 2020 through to completion in May this year. In our conversation today, we'll be covering their role as patient advocates, their reflections on their QI journey and their QI projects on transition. This podcast has been brought to you by the Royal College of Paediatrics and Child Health. Your hosts today are Andrea Srur, Programme Manager for the Diabetes Quality Team, and myself, Quality Improvement Project Manager. So before we go straight into your QI projects, could you tell us a little bit about your role as patient advocates?
Hi, I'm Jo. The patient advocate role, I think it's quite unique, and I don't think there's any other role like ours really, or we've never come across any other team that has patient advocates. So myself and Amanda, we are a support role, so we support the nurses. And we go and do visits within schools to support the children at any age, and offer advice and look at the downloads and things, and then we'll liaise with the nurses if there's a possible changes that we see that might need to be made. And then also we do visits with the families at home and support new patients, and also doing sort of education and things like that really. So we're more there to sort of build good rapport and relationship really with the families. Would you agree, Amanda?
I would. Hi, I'm Amanda. I think one of the things that's pretty unique about Jo and I is we sit somewhere between the nurse and the patient, in that we can be slightly more informal, or we can meet in more informal settings, which is one of the things that we love about our job, that, you know, if we have a young child struggling or a teenager, we could actually go meet them for a coffee. So I suppose some of our role may overlap with that of a youth worker. You certainly can't class Jo and I as youth workers. We're not youth, are we, Jo? We're definitely not youth. But I think we're more of that empathy role, that we'd like to think that we're kind of the buffer sometimes when they come into clinic. Often the patients will open up to myself and Jo far more than they will when they get into clinic and feel intimidated by professionals in inverted commas. So we're a little bit more informal, that they could come in and say, I've had a really bad week. Please don't let them, have a go at me in clinic. Or we can feed back tiny vital bits of information that make that consultation so much more focused and more appropriate to that patient, because they might just tell us something that we feel is really important as to how the consultant handles that consultation. So we're kind of a little bit of a buffer and a support role, if that kind of makes sense.
Yeah, absolutely. Thank you. And am I right in saying that you work across different services as well then? Is it just the diabetes services? Are you there full time, or are you kind of there on a part-time basis?
So we do purely work in the children's diabetes team. So we're cross-site, so we've got 2 hospitals within the trust. So myself and Amanda, I work at Huddersfield, and Amanda tends to cover the Calderdale side, but then we do cover for each other when we're on holiday and things. Also, just to mention as well, that I don't think we have mentioned, we organise trips and sort of things like that for the children, and sort of event days where they can come along and do activities and things. So that's a big part of our role as well, isn't it, Amanda, really?
I think the socialising, I know, Jo, haven't we? We've kind of, in the past, pre-COVID, organised like appropriate age level play sessions. So like under 5s, 5 to 7s. We had a teenage girls bowling night. We've had a young teen guys doing racing, go-kart racing. And I think if we spot a need or a group of young people who we feel we need to get together, we're really lucky in our role that we're able to kind of facilitate that. And that we've had massive feedback about that, and also about the residential trips, like Jo says. I am aware Diabetes UK do them nationally, but I think we're one of a pretty unique team who historically have done these residential trips for years and years, going back 20 years in Calderdale and Huddersfield, we've got a very active parent support group that have provided money, and these trips are funded by fundraising. And we take, last year, pre-COVID, we took a group to an activity centre. And I think the beauty of that is that the patients get to know us as people as well and sit more comfortable in the relationship. And again, that's massive, Jo, isn't it?
Yeah,
really, of our relationships with our caseload, really, when we can do that.
Yeah. And with the families as well, I think they really appreciate it, because obviously it's a bit of respite almost for them as well, and they know that the children are safe and getting the benefits of meeting other children as well, which I think is key, and makes it such a different sort of experience for them somehow, because they know that all those other children on that trip are the same as them. And you just sometimes see quite a different side to them, don't you, really, which is really valuable.
I think as well, I'm really proud of the relationships Jo and I nurture with the schools. We spend a lot of time with the medical welfare officers and nurses in school.
Yeah, bridging it. Yeah, isn't it? Yeah,
they become, I call them, the fourth member of our team, because we have schools in both sides of the trust who have up to 9, 10 or 11 at times diabetic patients in the schools. So Jo and I's role there, we have more time to go in and spend time with the people looking after the children in school, empowering them, and often they can filter out minor questions that would come to the team. Obviously they come to the team for a medical issue, but we kind of encourage them to get the children to download at home. Some of the schools we've taught them to download in schools for us, for some of the families that aren't able to do it. So I think we have a fantastic relationship with all our schools, Jo, don't we?
Yeah.
And often Sarah, our boss, will describe, we often will go in if there's an issue with a parent who's upset with some of the care in school. We go in a little bit like UN peacemakers to try and listen to all sides and mediate and make sure that relationship is maintained and that the school feel confident, because often school teachers are terrified of asking what they think is a stupid question. But if Jo and I can go in and just explain it in really simple terms, show them the DigiBeat films, give them resources, it's been invaluable, Jo, hasn't it? Because I think, a lot of our schools are really empowered and we're really proud of that, aren't we?
Yeah, and you do build up a relationship with them, because obviously they know the children as we do, so I think that is key and part of their treatment really as well.
This is obviously a very unique role that you have here, and it has so much potential in terms of building relationship with children and schools and empowering them and building bridges between patients and their families and the MDT team. So how do you get involved in the QI collaborative, and what do you think you bring into the QI collaborative as representatives of the MDT team that you're working with?
Well, for us, it was just such a good opportunity. Obviously, we were sort of, I think, one of the more sort of later groups to go through as a team, weren't we? So it was such an opportunity for us. And I think because me and Amanda just feel so quite passionate about things, and sort of we felt that transition for us, which is what we did for the QI, was an area where we've all felt for quite some time that there's just things aren't probably quite where we want them to be, really. So we felt that was our good area to pick and to work on. And we've absolutely thoroughly enjoyed the QI process. It's been fantastic, really. It really has. And we've had a lady called Alison Lodge from the trust who has supported us, because she's sort of works, sort of on QI things and service improvements and things, and she's helped us greatly, which was one of the things that obviously they mentioned in the beginning, Matt and Tricia, to get somebody from the trust involved and on board, and that actually was just so valuable, wasn't it, to us? And she's sort of guided us and also pulled us in a bit at times and kept us on track, because and just sort of given us a bit of focus sometimes. We go with all these ideas and she's sort of guided us, and we've kept things in key with working with what we want as a team, but also within what the trust expectations are and things as well. So it's been fab.
Joe's absolutely right. We do need reining in, because we get so excited, and we said to Alison when she met us, you will rein us in, because we will get carried away and excited. And I think we've really appreciated the input from Matt and Tricia on the quarterly meetings for the QI champions, because Tricia and Matt have been fab as well, pointing things out, and again reining us in, because and also acknowledging to us that a little step is a step, and even if it's not a huge thing, we've made a tiny difference or intervention in that patient's life. And you know, like Joe said, the transition thing, you know, we both feel that sometimes we lose these patients in transition for a variety of reasons. And often it's because they disengage with the consultants or the nurses and feel judged. We did a fantastic survey which gave us some incredible feedback, and we're really proud of that, and we're really trying to listen to the young people's voices, didn't we, Joe, about what they want out of that consultation. And a massive thing that came out as well was about the young person being able to discuss their mental health in clinic, and that they're not always brave enough to do that. And again, as advocates, that is something in schools that we talk to them on a one-to-one personal basis and can signpost, or sometimes they can just offload onto us, and sometimes that's all they need to do, and sometimes they need us as professionals to agree with them that it is really, really tough and not gloss over it. And that's one thing I've found, that just to admit to a young person, look, this condition is relentless, it's rubbish, it's hard, I'm not surprised you feel like that. It's so important that we acknowledge that, isn't it, Joe? Joe's a massive advocate for our safeguarding as well, so we go to courses together to try and learn how to speak to young people, how to identify safeguarding issues as well. So we're very much aware of the pressures on the teens, aren't we, Joe, between us? And I think we try and empower ourselves to signpost, and that was why, again, transition was a massive thing, to listen to that teenage voice as well, and how challenging it is for them in this social media world as well.
Thank you, and it's good to hear that you still sound really excited about this, even right at the end of the programme, as well as you did at the beginning, which is great to hear. I'm just going to move on to the project itself then, transition. Would you be able to give us a run through, please? Because you said you were keen on working on transition anyway, and what were the kind of the beginning ideas that came up, and what interventions did you start to put in place?
I think for us it was sort of knowing that there was a couple of differences between the sites, because obviously I was just saying we've got Calderdale and Huddersfield hospitals, so we needed to make sure that things were more sort of smoother, because over at the Calderdale hospital, obviously they tend to keep them a little bit longer, and whereas we sort of tend to sort of have a cut-off point at 18, and that's it. They go not through being cutthroat or anything, but just how that tends to how it being and for space and things, you know. Whereas sometimes I think over at Calderdale, we've hung on to them a bit longer. And I think the physical environment as well, because in Calderdale we have a separate building which is the diabetes centre where the adults go, whereas in Huddersfield it's still the same environment in the children's clinic, albeit in an evening. So we were checking out like the appropriateness of the environment. But also it was, as Joe says, it was the coming into transition, preparing them to come in. Yeah, that was a big thing, preparing them to go out. We didn't feel that we did enough of that, did we? The preparation of them coming in. It was almost like, oh, well, your next clinic, you're going to be in transition, and we felt that wasn't really enough, really. So then we came up with the idea of sort of doing a survey, didn't we, really, to get obviously the opinions of the children who are in transition, or some that have also left just very recently the service, to find out how they felt about things. And then that's what sort of gradually led us on to producing this checklist, which is what what we're going to do. We're nearly there with it. We're meeting next week, aren't we, just to finalise, to actually put it on System 1. But it's completed, and the checklist is to go through various topics to make sure that they're ready, and looking at doing this maybe 6 months before they're going into transition, to build up to that process sooner and prepare them what the expectations are of what happens once you're there, and so that the parents can get their heads around that a bit, because I think for some they're moving very quickly and very easily, and others it's a bit of a shock and a bit sort of, what's going on here, so I think it's just about preparing those expectations so that they generally have a better experience and hopefully become more independent and confident with managing their own type 1 diabetes, obviously going forward.
Because Alison, our QI lady, kept saying it's about the patient experience, the buzzword, and patient focused. And as Jo said, we identified that some were having a much better experience in transition than others. So we were kind of questioning why that was. One of the other things that came up as well through discussions and with the young people forum, that we kind of had a group of young people that we sent things out for them to look at as well and feedback to us, was, when we introduced the parent leaving the room and how that happens, and not only preparing the young person for that, but also preparing the child for that. And obviously they all go at different stages, but for some it can become quite a shock when suddenly mum, dad or whoever or carer comes out of the room, and vice versa for the parent. So we spent time again with the patient focus group, and again that's been something fantastic that's come out of QI, that we've picked up a patient ambassador who wants to be a transition rep for the whole of the trust, because she enjoyed the process so much, feeding back to us about the whole process and the survey. So we want to build on that as well. And Jo and I, as part of our role moving out of COVID, we want to work with the young people more as we can to get focus groups and to do more group feedback sessions, because I think QI has taught us both that we have to listen to that voice, don't we?
Yeah, we do. Yeah, definitely.
So it's really interesting hearing how you approach the service and actually putting children at the center of care within transition. That it's probably one of the biggest challenges that we always hear that services are dealing with. I wanted to ask you, what were the key challenges that you came up during the project in terms of implementation, maybe team engagement, and how did you address them to be able to have a successful result?
Yeah, I think the biggest challenge is, I think for us, we felt that COVID sort of gave us a bit of an advantage, to be honest, in some ways, with meeting with the team and being able to do that, because we were using Teams and that allowed us to engage. But the biggest thing was for us, because of COVID, it was actually getting the adult consultants, just due to their time and availability, they weren't able to join us. So that was one of the challenges initially at the beginning, wasn't it? And quite,
well, I think it still is
hard. Yeah, it is probably.
We can come up with all these fantastic ideas, but then, we need, and it's made us realise a lot of the constraints the consultants are under that we weren't aware of before. So again, it's reining our horse in. We can come up with all these ideas, but if the consultants aren't able to deliver physically or geographically or under the constraints of the trust, with numbers in transition, we have to work within that as well. So it kind of highlighted that to us, Jo, didn't it? And an appreciation of how they have to manage. And, one of our consultants was literally whipped away to the, the COVID ward and managing things like that. But I think moving forwards, it's having a common theme if we can, and trying to use a lot of what we've learned, within the consultations. And some of the things are about how, the conversations go with the consultants and the young person, and how the young person feels a little bit more able to open up as well, which I think that keeps the engagement. And we've also pulled in our new psychologist, Sam, about how to talk to teenagers, and maybe setting up some sessions with the consultants as well to give them some support, because as we all know, teenagers are not easy to talk to. They won't open up, particularly in a room full of professionals. So it's how, as a team, we kind of manage that to get the best out of the consultation. And again, this is where Joe and I may come in, that we are like the bridge between that. So if we're in the consultation, we may be allowed to say things that the young person wants to be said, or we may be able to tentatively bring up that subject. And that did come back quite a lot in the survey that we did, that they felt, scared to speak up sometimes. One of the things that did surprise us was that they preferred the face-to-face contact, which we all assumed, again, that they would prefer the Teams, didn't we, Joe? They still like that face-to-face, and they still like the fact, one of them said, that you get to know us as a person and talk to us as a person, and not just someone with diabetes. You talk to us that, firstly, that you're a person, and then the diabetes comes after. That was quite a predominant theme with a few of them as well.
I think as well, one of the other challenges for us with the QI was actually the delegation of the work. We struggled a bit with that, especially more so in the beginning, because we probably hadn't quite knew where we were going with things, and we felt that it came for later for us with the delegation, that we felt that once we knew where we were going more and what we'd decided on, and once we'd done the checklist and things that we needed to pull from that, so things like the leaflets and things, so that's where we sort of signposted it and delegated the team to do sort of various little bits there, really.
We like Tricia's analogy of conducting the orchestra. We thought that was a really good one.
Yeah.
So we kind of did the building blocks, and then we were trying to delegate. And it's not always easy, because everybody's under time restraints, aren't they, Joe? And I think Joe and I only work 3 days a week, and we try and fit 5 days work into 3. We both do. We're very guilty of that. But I think COVID did give us that time when we weren't out visiting schools to really concentrate on this, didn't it? And understand the QI process of how to try within the team to get us all on the same page as much as we can. And it's the massive thing about sharing the information together as well, and making sure that, everybody has heard the feedback, everybody's aware of what's going on, and, we're all basically trying to sing from the same song sheet, which is what Tricia and Matt advocated as well, really. So they trained as well. We did listen, Matt, and you did train as well.
Yeah. Glad to hear it. I can certainly hear that now. And just to touch, I know you touched upon the point before about you've employed a patient ambassador, and you're very in touch with focusing this QI project on the patient experience. I'm just interested if you could tell a little bit more about how you involved young people in the design of the project, getting feedback.
Yeah, so we initially we came up with the survey, and then what we did is we sort of pulled off our transition patients. So we had Alison, so we did delegate something there. Alison, one of our colleagues, she sort of pulled off how many people we've currently got in transition and who they were. And then what we did is we obviously contacted them. We divided it up, actually, didn't we, between the teams. So we all had a group of people to contact from the transition people to make a phone call with and have a chat about, and just say that we're doing the QI project. This is something that we want to improve the service for you, and that we're going to be doing a survey which we'd like you to take part in. It is anonymous, which it was, if you complete it. But we felt that by having that phone call and making it personal to them, we felt that we would get more of sort of more questionnaires and more feedback, coming back to us, as opposed to just sending it out to them. And I think we did. It worked, didn't it? Yeah,
we got. I think we got about 70 on the caseload, and I think we got about 20 over 20 really good responses. Which Alison, our QI, said that was pretty good for teenagers.
And I know Tricia said, even if you get only 10 back, then you've still got, So we felt that getting 20 back was fabulous, really, out of that cohort. So, and we could pull some really good information from it, couldn't we?
We also had a group of, I think, 6. We chose from 3 from either side, didn't we, Joe? Who were really keen, and we sent the survey out to them to approve the questions, before we actually sent them or asked them to improve on the questions. It's so long ago, Matt, we can't remember what we did now. It's nearly a year.
So we did like a dummy run almost with them, and then asked them how they'd feel about it, and then they sort of added in questions that we felt that we'd missed out. But the majority of them were quite happy with what we'd done, really, weren't they?
I know Alison used the buzzword, co-design. So we did co-design the survey with the young people, and then when it was ready, and we've done the same with the transition checklist that we've sent that out to a number of our patients as well. And again,
we held a focus group.
We had a little focus group as well, and we want to, we want to continue to do that, really.
You have been doing this for a few months now. Have you been able to measure the impact that it's having on children on the transition service? For example, if they're improving the outcomes, or if it's improving the relationship with the rest of the team? Have you been able to quantify or qualify in a way?
What we've said is that we said we'd do it in a year, actually, didn't we? We said, because we've obviously got the checklist and things, but we still just need to just put it onto system one now, don't we? There was just a few bits to add in, even though it's completed, and we're meeting next week just to completely finalise it and send it out again once more to the team, and then it will be on system one, and then we'll be up and running with using it, and hopefully clinics will start gradually coming back into face-to-face contact as well, which will be much easier. But what we thought of the rollout of it would be that we'd either make an appointment with them, didn't we, and do it face-to-face and go through some of the things about transition that, in the next 6 months you'll be shortly transitioning. We've got a checklist, and then it'll just stay on the system, and we can just keep referring to it and make sure that we've covered all those areas. So we did say probably in about a year, didn't we?
Probably re-survey. I think the challenge for all of us has been, COVID, that all the consultations have been on Teams, and we just don't have it. And we're saying as a team now, that novelty is definitely wearing off with everybody, and we really want to try and get back face to face and engage with these young people and our other people in the caseload as well, because they're tired of it, we're tired of not seeing them. And I think to be able to assess it fully, we won't be able to until we've got that personal contact back, because that's what the survey was screaming out at us, saying, we like the personal contact, we like that interaction, and so I think it's going to take a little bit of time. I think we did say that we would resurvey, Jo, didn't we? We would resurvey again, because to be honest, the young people coming into transition recently haven't had what we would class as normal experience anyway. It's just gone from one screen on a Friday morning or a Tuesday afternoon to one screen on a Thursday evening. So in some ways they won't really have noticed much difference in that way. So it's hard to quantify and measure at this moment in time, but we're hoping to build on that. And Jo and I are going to continue to book in these QI things, aren't we? So we can keep spinning the plates and checking where we're at. Even if we do that fortnightly, Tricia was advising us in one of the presentations not to go to monthly, to try and keep it weekly or fortnightly, because it will dwindle out. And she's absolutely right.
Yeah.
And one of the things that helped us with planning all this was that we literally sat down together and planned all these dates and sent the invitations out to all the team, didn't we?
Yeah.
We did it a month or 6 weeks in advance. Yeah. And that really helped, Jo, didn't it? To structure it for us, but also to allocate the time to make sure we achieve something, because if we hadn't have done that,
we wouldn't have done
advance, we wouldn't have got to where we are, really. We really wouldn't.
No.
Perhaps you've just covered it there in your response, but I was just wanting to ask about the fact that your team and lots of teams around the country who have taken part in this programme have been doing QI work within a period of a lot of uncertainty over the last year or so, and a lot of staff shortages and pressures on resources and things like that. And I just wondered your take on this. How did you keep up motivation for yourselves and for your team as well, just maintain that continuity?
I think sort of obviously just us being quite eager anyway to improve things, and just booking in the time, really, and we just made sure we had that time set aside, And we kept the regular meetings with the team to keep them motivated. So we were updating them, and then we pulled them all in when we had to do the sessions that obviously Matt and Tricia had set as well for us to work on. So that was a big part of it as well. And we just kept them involved and updating them with what we were doing. And presenting the things that we'd come up with, obviously, once we got the survey and seeing what people's feedback was on the questions. So there was always quite a lot to be showing and involve them, really. And I think that just kept the momentum going and the movement, really. And obviously, they all were in agreement with what we were doing. So I think it's nice when somebody else is doing it all as well, really, isn't it? And geeing them on. So, I think that's how it worked for us, really, wasn't it, with the motivation?
We could feel the progress, Jo, couldn't we? We could feel it as we were going along. Each week we felt we'd achieved a little bit more, towards...
Well, we've gained the 2 nurses as well through this process. We've now got an adult nurse on both sides for both clinics, which is fantastic because we'd lost those. We'd had them at one time, but we'd lost them. And through this, I think it sort of pushed the consultants to take it a bit further. And we've got this now going forward, which is fantastic.
Definitely. With our involvement with this project, it came to the attention of, management, and we've presented at various forums, and we're presenting at another one, and we may end up presenting to the board at some point. They've mentioned showing our poster and talking about it. Yeah. And I think because transition is quite a national buzzword, and, within the trust as well, there's work being done on transition. So I think we hit the right topic at the right time as well. And that, that we've had encouragement from above as well, Jo, haven't we, as well within our team, but we've had a lot of positive feedback from, our nursing management in the trust as well, which has encouraged us to keep going and to know that we are making a difference. And to get our nurse back, we've transition clinic tonight and we've got our nurse back, and that's the first time since last March when COVID locked down that we've had an adult transition nurse. And I honestly don't think that would have happened if Jo and I hadn't have kick this process off. And so that's an actual physical achievement that we've got. She'll be on the teams tonight, and our young people have the benefit of meeting her, and so that I do feel if we hadn't have done this, and like you say in Huddersfield, your nurse as well, it would probably have just dwindled on and not happened.
Yeah, definitely.
So we feel like we've drawn attention to ourselves, haven't we?
I was going to ask a quick question. I've not, surprisingly, I've not got that written down here. You've talked about how you've built relationships, good working relationships with a lot of different stakeholders, really, school, patients, families. But what was it how did you build that positive working relationship with the adult team?
So we have involved them with all the emails and things. We've also asked them for feedback on the checklist, and the nurses both commented and added bits in. So I think that's really made them feel involved and included. I know the consultants as well have been liaising with the adult consultants, and sort of, even though we realise that they've got demands of COVID and they were on the wards and things, we've still tried to include them, like I say, by inviting them to meetings, even though we're sort of probably knowing that they won't be able to attend, but also forwarding all the information onto them so that they can keep in the loop. And I think that's been really helpful, really. And I think we do work really close with them anyway through transition. And obviously we have had handover meetings at the end of clinics, and, you do sort of get to know them, and hopefully we all feel part of a team together with them as well, don't we, really?
I think one of the benefits as well is Jo and I have had, because we've booked in the QI sessions with the consultants on our own rather than the whole team, that again has enabled us to have access to them, which we wouldn't have had without doing it on Teams, because we've literally had half an hour a month or every fortnight,
and they've hopped in,
and then they've gone on and had those conversations, Jo, haven't they, with the adult consultants on our behalf. Even if we couldn't get them into that, they've taken on board what we've said and what we're doing, and then they've fed that back within their own circles, and then that's gone higher, and that's where I say the appreciation we've had of the constraints they work under as well.
I think it has been really inspiring listening to you, and probably the other people that listen will get a lot of good ideas and will think, oh wow, maybe we can do this in our service as well. So looking back, for the people that is listening, is there anything that you would done differently now, or like lessons learned that you would like to share with everyone, saying, look, maybe we should have done this differently to achieve a different outcome?
I don't think. I don't know how you feel, man, but I don't feel like there is, because I think I sort of knew, this was a process we wanted to go through, but probably was more apprehensive coming into it. And I feel like we've come out probably better than I thought we would in a way, which I know that sounds terrible, but I just think it's a new process and we didn't know what was going to, and especially through it being teams and things, I really didn't know how it was going to turn out. But I feel like we've come out top trumps almost, really. But I think it is due to the work that we've put in. The only thing I would really recommend, and I think, is just making sure you get in touch with that person in the trust, because Alison Lodge has been invaluable to us, and I did that as a key thing right from the beginning, and we've used her so much, haven't we, Amanda? And she's just been brilliant. And like I say, it's just having those other eyes in on the project externally, but somebody who also knows what the trust is wanting as well, so it has been really good. So I would really recommend that to anybody who's doing QI, but also to look at it as an opportunity to improve your service and not to be sort of feel daunted by it all, really, because I think at the beginning you think, we're going to get through this, but it just gradually builds, doesn't it? And
it's like you say, it's
runs through it, and it is the little steps, and you've got to sort of take those away with you, haven't you, really? But we've loved it, haven't we?
We've loved it. I think if we had any frustrations, it would be sometimes trying to get people as excited as we are, because we do get excited very quickly, as I say, and we're known to be excited, aren't we, Jo? So I think sometimes when other people weren't getting quite excited about our surveys and things like that, but just accepting that we were the conductors and everybody in the orchestra maybe is not, or doesn't have the time, to be quite as on board, and appreciation of that, really. But each person has a role, and we've tried to designate that, haven't we?
We have,
for their own strengths. It's like the hat thing that Matt and Tricia sent out, who, with the different hats, we had a bit of a chuckle about which hat we'd give to which person in the team, really. Yeah. So it's an appreciation that everybody's different as well in your own team, and not everybody's going to take it quite as on board or put the hand up to volunteer, because often Jo and I, as roles of advocates, somebody will just say, will somebody do this? And before we can help it, we've said yes. That's what we're like, aren't we?
Yeah. It's step by step at the end.
Yes.
I feel like that maybe sounds a bit, sort of what would you do differently? But I think I probably, like I say, I think it went smoother than what I thought initially in the beginning. So I think if we did it again, I'd do this similar things, because I think, we did.
I think one thing that's really helped, our boss Sarah has been fantastic, our line manager, and she has just constantly thanked us, appreciated everything we've done. And it's not that you go out there doing for that, but it makes...
She does support us, and she's
incredibly...
always backs what we're doing, and sort of encourages us to keep going.
And when we have got a little tired with it, as we all have through COVID, she's, as a team, she's been fantastic and propped us all throughout the last 12 months. So we couldn't have done any of this, could we, without Sarah encouraging us? So we have to say that, she's been fantastic.
She has. She's a star.
Great, that's good to hear that you've been supported from different parts of the organisation, as well as your own management team. We're getting into the final stages of the recording now, down to the last couple of questions. And I just wanted to, looking forward, you've completed the programme and you've made improvements to your service. How do you intend on continuing with that now?
What was the conference we listened to the other day?
We attended the national conference.
Yes. So we did pull a few ideas out of there, and we were saying maybe we need to look at the parents sort of on that side of transition, because I think they go through a bit of a process as well as the child gets older. And there was something about like a parent pack, and we were saying maybe something that's what we can look at. And I think for us, the key thing will be doing some education, but sort of homing in on the team's opportunity of doing education with the families, because that is an area we've always struggled with, of getting engagement. And we were thinking maybe doing them as webinars and asking lots of different families to come on board and watch, and maybe that might be something they can access a lot easier from home. So we're going to give that a go. So I think there's things around that, isn't there, really, that we want to do? I mean, you might have
I think as well, it's like we said it earlier, it's about planning the meetings in, and Joe and I making sure that we don't get pulled away and get involved in firefighting that we can often do within the team, and to allocate that time, and also to make sure that, you know, that we plan it into our limited 3 days a week, that we can have that time together, because, you know, we really do feed off each other. We're both really passionate about each other. We both, you know, we've had some QI sessions when one of us has been tired and the other one pulls the other one up. And I think if you were giving advice to future teams, having two is a good idea, really, because, you know, putting it on one person, I suppose that will be one of the most important things we've had out of this, is that, you know, say if one of us have had a bad day and haven't quite got our brains together, the other one has pulled the other one up within the QI meeting. There've been many days like that when through COVID, when, you know, we've both felt, you know, really lethargic and let's all keep going. And I think, you know, everybody's felt like that. But, you know, having each other, you know, at the end of the day, we often say to each other, oh, we've just pulled that out of the bag.
Out of the bag at the end of it,
at the last minute between us. And that's the beauty of it, I think, you know, and we've said we want to continue that, to support each other as advocates. And it's also made us, we've said, relook at our role as advocates again, of how we can fine tune ourselves even more within the role of QI and, you know, the patient experience and the team as well. And instead of often firefighting, going back to the, you know, things that we're really passionate about, to pass that passion on to our patients and families as well.
That's all we have time for today. So Joe and Amanda, it's been great to speak to you today. We've heard so much about what your unique role as patient advocate involves and how this has shaped your approach to QI. What's really stuck out for us is not only the improvement project itself, but also the passion and energy that you bring into your work. And this positive approach no doubt improves the outcome of your improvement work and the experience of children and their families. We look forward to catching up with you again in the future to find out how your improvement work is developing. To our listeners, the QI programme is looking for teams to take part in future podcasts. So if you'd like to talk to us about your improvements to inspire and inform others, then please contact us at diabetes.quality@rcpch.ac.uk.
Bye-bye.